Okay, I'd like to welcome everyone. We're starting almost exactly on time, like a well-oiled Swiss watch or the Swiss train industry. If you've ever been to Switzerland, they run on time. So that's my main task today, is keeping all of our fantastic speakers on time, so we have plenty of time for question and answer. So I want to welcome everyone to our annual Institute for Prostate Cancer Research Symposium. This room is a little bit different. In the past, we've had it in a different building over in Pelton, but because they're working on the electrical systems, they wouldn't allow us to have the meeting there this year, but we'll probably be back there next year. So we have a few little different logistics for this meeting. It's a little bit more difficult for the question and answer period. We'll get to that in a moment as we move into that phase of the discussion, but hopefully you'll be able to hear all of the speakers well. If any of us aren't articulating or projecting, please raise your hand and we'll remind the speakers to speak into this microphone. So this is our sixth annual event. It's hard to believe we've been doing this for 6 years, and it's really our report back to the community on the latest research and treatment efforts around prostate cancer. So we really view this as a two-way street from us in terms of communicating information, but also hearing back from you what's most relevant to prostate cancer in the community. We have a very ambitious agenda today. Some of the talks are updates from talks that you heard last year or the year before. These were very well received, and it seems like they're very useful to reinforce some of the messages that were presented previously and update them with new information. And then we have a number of very new talks that explore and communicate to you a lot of really exciting fields, areas, and particularly in diagnostics of imaging procedures and kind of minimally invasive approaches for diagnosing prostate cancer. So there's a session focused on that as well. So just a word about the IPCR. So the Institute of Prostate Cancer Research was really instigated by Dr. Paul Lang, who was the chairman of urology at the University of Washington. He recognized more than 10 years ago that there were tremendous strengths both at Fred Hutchinson Cancer Research Center and the University of Washington around prostate cancer, and the idea is that there was a lot of synergy, and this really spawned the development of this institute, which brings together more than 30 scientists, researchers, clinicians, population scientists, individuals interested in prevention, all focused around prostate cancer, and this is really some of the culmination of that work that continues today. Some of the details of the IPCR, the accomplishments, the areas of research and treatment are shown on a website here that's hosted at Fred Hutch, so you're more than welcome to peruse that, and also there's ideas for advocacy of how you can participate as well. We have a number of objectives here for this meeting. First and foremost is really to provide you with the information around prevention, screening, and treatment of prostate cancer. We want to highlight some exciting new developments that occurred here in Seattle, in your own backyard, emphasizing the kind of cutting-edge work that we continue to do. And we also have dedicated time after each session for questions from you, and this is, to me, always the most interesting part of the whole symposium, is to get your questions. That really kind of refocuses what we do on a day-to-day basis. So that's very important. And then I also want to emphasize this idea of partnership. It's not just us here, it's not just you there, it's really how we interact together, and that's very important as we think about advocacy for certainly for funding for research in the U.S. and worldwide. I do want to dedicate this symposium, we do this every year, to two individuals, Todd Brahman and James Matson. They were heroic individuals that lost their lives this year to prostate cancer, and I think they each exemplified the type of qualities that we see in men with prostate cancer: the brotherhood, the tenacity, optimism, and altruism that we all see every day in patients that are affected with this disease. They really were advocates. They were tireless in the community, helping others, and I think they really represent those in the community that we've lost. So these men and others like them remind us the urgency, really, that we have to combat this disease. I want to thank a number of individuals, in case I forget to at the end. Certainly Nola Klemfas, who was instrumental in really organizing this entire symposium, the development staff at Fred Hutchinson Cancer Research Center and the University of Washington, the many prostate cancer support groups that are around the state that really serve as local advocacy and communication groups back to you. We have 3 sponsors this year that helped underwrite the cost of the symposium. Janssen, Color Genomics, and Homegrown provided some of the food and lunches that you'll be enjoying later today. And then many generous donors to the Institute for Prostate Cancer Research. So I'll briefly touch on the agenda. We'll obviously dig into this as we go. The first session this morning is focusing really on screening, early detection, diet, exercise, prevention type strategies, and also discussing some really exciting developments around genetic predisposition to prostate cancer. And then we'll end the session with a Washington State initiative that you heard initially about last year that we call Empower Northwest. And there's been a lot of movement in that area and some exciting results there. And then we'll have 15 minutes for your question and answers for these speakers, and then we'll have a coffee break. Then the next session before lunch really focuses on this exciting area about minimally invasive diagnostics. There's been really a sea change in how we use imaging, such as MRI and PET scans, to diagnose prostate cancer. And then there's interesting work going on in diagnostic biomarkers that can be used in the urine or the blood to more pinpoint features of prostate cancer without needing invasive type biopsies and tests. Then we'll have another question and answer period and then break for lunch. And then this afternoon, there'll be a focus on treatment of more advanced prostate cancer. We have a session that discusses really the nitty-gritty of clinical trials. That's often a mystery to a lot of individuals. What are clinical trials? They get worried about placebo-controlled trials and randomized trials. So Bruce Montgomery will lead this along with 2 patients that have participated in clinical trials, and we'll have a Q&A period to ask them, for example, what their concerns were going in and what ultimately happened. Then we'll talk a bit about precision oncology, and this really is using the genetic features of a tumor to more precisely guide therapy, and then end with the future. What kind of things are we anticipating over the next year or two in terms of new therapeutic agents around immunotherapy and other targeted therapies? We'll have another question and answer period and then the closing. So I'm just going to give a brief overview before we get into the actual talks to really define where we are today. What are we really dealing with? And I want to tell you a little anecdote that I think emphasizes the importance of doing this. So maybe 7 years or so ago, I gave a talk over in Sequim. It was sponsored by Fred Hutch. It was really an outreach talk, very similar to this one, to a community of 50 or 60 individuals that I thought probably had quite a bit of knowledge around prostate cancer already. So I gave this talk about 45 minutes, really laying out the landscape of prostate cancer. And it was one of the few talks my wife was able to attend, so she was back in the audience. And afterwards, she told me she was kind of cringing at some of the things that I was saying because the language I was using were words like indolent prostate cancer, and she didn't really even know the context of what that word indolent meant in terms of how you think about a disease or a cancer. So the emphasis was I didn't describe it very well, understanding what the audience knew or needed to know. And this was really brought home by the question and answer period. So after I finished my 45-minute talk, I asked for questions. And the very first question was, where's the prostate? So I think I needed to start with the basics, which I failed to do. So that's where we're starting today. There's the prostate, okay? But perhaps more specifically, there's the prostate. And I think you're all aware that it's a very strategic location that whoever designed it probably didn't do the best job in terms of the plumbing and how we think about it working and things. So I'll just give just 2 minutes really of the facts and figures. You can readily get this information from an annual report that the American Cancer Society provides. These are the updated statistics for 2017, and I think they're still very sobering about the problem that we're dealing with. So if you think about all cancer in the United States, every month there are 50,000 deaths due to cancer in the U.S. So more than 140,000 diagnoses. So this translates every day to more than 1,500 deaths due to cancer. And if you think about it, dividing it every minute, there's a death due to cancer every day in the United States. Prostate cancer accounts for a lot of this. So just the new diagnoses every year, you can see that 19% of all cancer diagnosed in the U.S. is prostate cancer. That's a pretty staggering number. And the number of deaths due to prostate cancer are 8% of the total. So this is a major disease that we face every day. Fascinatingly, the incidence rates or the detection rates have dropped dramatically over the last couple decades, and Dr. Etzioni may provide some insights for this. This big peak, that big peak on the curve here is when PSA screening was very, very prominent, and many of you know that more recently the recommendations for PSA screening are basically not to do screening, or at least start off simply with a discussion, but not routinely to do it. This probably accounts for some of the major drop in new diagnoses. But very interestingly, the death rate, so the number of men per, say, 100,000 men in the U.S. has also been dropping. You can see in the gray line here, it's been declining also since the 1990s. Part of this, we think, is due to that early phase of early detection, and probably another part is related to better treatments for advanced disease. But honestly, we don't really know what accounts for the majority of this decline. Dr. Etzioni has done a lot of work in this area and can probably provide some insights into that. Yet, despite this decline, in the U.S., we have more than 160,000 cases of new diagnoses of prostate cancer every year, and more than 26,000 deaths in the U.S. every year due to prostate cancer. So when you think about the lifetime probability, it's 1 in every 8 men will be diagnosed with prostate cancer, and 1 in every 40 men will die of prostate cancer. These are really staggering statistics if you think about it from the point of view of the entire country. Just in Washington State, in 2017, there are more than 3,500 new diagnoses projected and 620 deaths in our state. So I think that these are sobering numbers that really emphasize the urgency that we really need to think about in tackling prostate cancer. I would say there are many reasons for optimism. First, we're learning much more about risk and predisposition. You'll hear about that today. We're learning much more about prevention. You'll hear about that today. There are better screening tools. They're far from perfect, but every year they do get better and better. Optimism there. There's also major improvements in treating advanced disease. Although we're still struggling to actually cure it, we can extend survival substantially and improve quality of life. As you'll hear about at the very last talk, there are some really interesting responses to certain types of immune-based therapies. So there's a lot of excitement there. There are many smart and dedicated researchers that every day devote their day and week and month and year focused on prostate cancer, and we'll hear from them today. And then your participation in activism, the fact that you're all here today, to me is a very optimistic, helps us really believe and understand that we can cure this disease. So a few final details before we start. At lunch there will be tables from the support group and the sponsors outside in the hallway. We're going to open up the big atrium there for the lunches. We'll have about 45 minutes for that. All of these talks are being recorded and they will be posted to YouTube. We've done that every year. Hopefully you've been able to see them. So for friends that weren't able to be here today, or if you simply want them look at them again in between March Madness basketball games. You want to go back and look. They'll be up there. We will have question and answer cards for those of you who don't want to raise your hand. If you write a question down as we're going through the talks, at the Q&A sessions, we'll pass those cards. I'll try to moderate, because in the past what we've seen is sometimes we get the same question repeatedly, so that's a really important one to get across. So I'll moderate those. And then it's very important to have your feedback. I'll try to remember to ask for this again at the very end of the day. But how do we do this better? What other things should we be covering that we really didn't think about or didn't have time to present today? But in future IPCR symposium, we can cover them. So thank you. And as we begin, we're starting our first morning session with Dr. Etzioni. Let's see if I can get out of here. Hopefully I can. Here we go. So Dr. Etzioni is a researcher here at Fred Hutchinson Cancer Research Center.